This episode is sponsored by Grow Therapy. Grow Therapy was founded on the belief that quality mental health care should be accessible. It makes finding an in-network therapist easy. Go to growtherapy.com to find your match and let insurance pay for your therapy.
Welcome to a place where you'll leave feeling whole. The Counseling Podcast brings at-home counseling right to you, focusing on self-care, self-expression, and breaking down barriers. Dr. Jaclyn and Dr. Stokes bring over 20 years of combined experience and a new sense of style to the word counseling. The two use humor and lighthearted conversation to explore these deeper feelings. Let's take the stigma away from counseling together.
Welcome to the Counseling Podcast. Today we are joined by a special guest, psychologist Dr. Davisha Scudder, who will be speaking about self-care and preventing burnout. Dr. Davisha, please introduce yourself to our listeners and where they can find you.
Hi, listeners. My name is Dr. Davisha Scudder. I'm a licensed psychologist and I work for Growth Therapy, so you would be able to find me on there.
Perfect. And so you want to speak about self-care preventing burnout. So tell us what you're seeing in your practice today.
Correct. So I'm seeing that a lot of my clients are actually having this perception that self-care and even taking time to do anything outside of work is a waste of time. They also think that it's selfish and that they could be doing so much other stuff in life. So it's kind of disheartening as a psychologist to see that, but I do understand where it's coming from. Mm-hmm.
And what demographic are you seeing? Are you seeing more women younger in college or mothers or fathers, or what's the demographic you're seeing?
A really mixed demographic, I would say. So most of my clients are above the age of 18, and I would say as old as 50. So that range.
Yeah, and I feel like it's almost like an epidemic, right? Like the lack of self-care. And you made a really good point about how people, I think, perceive it as being selfish. As a mental health professional, how can we help transform that view that society has about self-care and needing to always be on, needing to always work? What do you feel like we can do as mental health professionals to work through that?
Right. So a lot of what I do is try to help the client understand that it is really a tool to use to better yourself, because you need something to help you maintain yourself. You also need that personal fulfillment, because to be honest, just going to work is not going to fulfill you all the way, even if you're passionate about your work. So I think that's a common misconception that people have. Mm-hmm.
And I find myself using the word boundaries with clients almost every day. I use that word multiple times a day with me, my family, and clients. So it's like finding those healthy boundaries in your day to, okay, I'm going to, work from this time to this time, at least implementing at least like 5 to 10 minutes of some type of self-care before maybe you have to do something else, but allowing yourself that time to kind of integrate into more time during the week to kind of get you used to, okay, it's normal for me to build these boundaries and have this time for myself. Do you encourage your clients to do that?
Mm-hmm. Absolutely. Because a lot of people have the misperception basically that, self-care has to be scheduled. And I don't think that's necessarily true, because you can implement self-care into any period of time. So like you said, you could be in the car listening to a playlist that makes you feel happy as you're going to run an errand that maybe you're not so excited about. And that's a way that you're implementing self-care in just that little activity. Mm-hmm.
Yeah, it's interesting that you say that, because I had a client today who we were working on more self-care time, and I was going through her day with her, and between her hours of getting off of work and then her fiance coming home, it's, what can I do in that time? And she was like, well, I have to do errands and chores. And I said, well, have a different attitude towards that and still make it your time and make that pleasurable for yourself. Of if you have to go, like you said, use that time in the car to zone out of like listening to, a podcast or having your time and going to the store and making it more enjoyable that you don't have to go to the store. it's still, I'm getting my own time to kind of just process my thoughts and, doing what I have to do, but not looking at it as like I'm still kind of working on the clock per se.
Exactly. And I think a good way to implement all these things too is to have an evening routine and a morning routine so that you're starting your day winding up and then winding down in a soothing way. So it's not like you're jumping out of bed and you're like, oh my God, I have to do all these things. And you're feeling anxious already at the beginning of the day.
Yeah, it's almost like I feel like too with people, I with my clients, I try to help them develop a self-care regimen, and I mean, you mentioned morning and evening routines, and I think so much of it comes down to our routines and us being really intentional about what we do to take care of ourselves. And I like to think of it in like the biopsychosocial spiritual way. What are the different methods that we can do in all those different elements of wellness that can help feed those specific areas?
That's a really good point, because it really is the well-roundedness of everything, right? Body, mind, soul, spirit, whatever fulfills you.
Absolutely. And I feel like when we're neglecting one of those areas, it impacts the whole picture. And I'm not always huge on, prescribing exercise for my clients, but I do strongly encourage it because of just the benefit of exercise, as we know, not only obviously physically, but then the psychological and emotional effects of that. I think is really important.
Absolutely. I actually have my clients within the first few sessions identify what they're already doing in their lives that makes them feel happy, because those are tools they're more likely to keep using, as opposed if I give them a list of common ones to do.
Yes, that makes a lot of sense. What do you feel like in your work? What ends up being the result of a lack of self-care? So when you have clients who come in, for our listeners to kind of understand maybe, the consequences of not practicing self-care, what do you notice in folks when that's happening?
So I think you're kind of speaking about burnout, maybe like when they're approaching burnout. And when I notice that in my clients, they're tending to feel very pessimistic, down, hopeless, helpless, because they've gotten past the point of where they should be. So basically, they're just so tired and numb, essentially. It's almost like depression, where you have to pull yourself out through action.
And that's where maybe starting small to make those small changes kind of helps to increase their self-confidence of, okay, I can do a couple of minutes a day to kind of get myself back out there and thinking I can do this, rather than getting, in that routine of I'm not going to do anything now, it's overwhelming, to kind of put that on my plate again.
Exactly. It does all build upon each other.
Yeah. And you mentioned burnout. I feel like the world is burnt out. I mean, I feel like so many people are struggling with burnout. And I think they don't even recognize it. I mean, I see that in my clients, like, that whole idea of working 70 hours a week and these things in our culture that really push for that like go mentality. And there are times where people come into my practice and they're like, they don't even realize they're burnt out. It's not even in their awareness. What are some signs of, a person being burnt out? I know you mentioned down and things like that, but what is a person going through in those situations?
So a lot of times what I see is a lack of motivation, because they've gotten to the point that they've been doing so much and not practicing the self-care that they have used all their resources, because you're not putting that energy back into yourself. It's kind of like if you think of a car and gas, you're not providing yourself the fuel to keep going and keep going. Yeah.
Absolutely.
Do you think it's also like that insecurity of I'm not doing enough, I have to do it, or overcompensate for other people in their family, whether they have a spouse or a partner, that they feel like if they're not doing enough, I have to kind of do more. And I never get time for myself because I'm always, thinking about all these other things.
And that reminds me a lot about people pleasing, because that's a big thing I see in therapy, where people don't realize that they are operating as a people pleaser because they're not saying no and they're not setting the boundaries. And so they're getting really tired because they're taking care of everything.
Yeah, we definitely see a lot of that in folks who maybe have more of a tendency to people please. I think those individuals also have a higher likelihood of lacking self care, unfortunately, because they're giving and all the time and they don't know how to set those appropriate boundaries.
Exactly. I think comparison too is a thing that contributes to this, because you could look maybe at someone else who seems more productive and
Mhm.
compare them to yourself, and you might feel less than.
And just to kind of expand onto, like, if it was an adult with children, if a parent is used to kind of going at that speed, kind of role modeling that behavior to their children of, you're not, like, I don't know how to kind of have those boundaries for myself, or have, if my parent doesn't show me the importance of that self-care. Not that it's like they're trying to intently, role model any negative behaviors, but just kind of, they think they're, like you said, the people pleaser, being perfectionist. And then
Mhm.
children start to see, well, I have to kind of operate at this speed as well.
Absolutely. And personally, that is something that I definitely saw modeled by my parents, who were workaholics.
Mm.
Essentially, they were workaholics. So I try to frame my life in a completely opposite way because of that. Mhm.
Yeah, that workaholism is definitely it's I think it's contagious too. Like I think that if we're raised in a family dynamic that that's kind of part of the family culture, but then
Mhm.
also society, right? Like what is the message that society is telling? Work hard. There's this kind of like mentality that I think people get their sense of worth doing that, and then all the while their self-care is just going downhill, down the drain.
Absolutely. This is something that I really learned throughout grad school, the importance of self-care. And I also realized, like, we're never explicitly taught this ever. It's like you have to develop this on your own, and it has to click within you, which is unfortunate, definitely.
And I think that unfortunately burnout is the way that most of us learn it, you know?
It's true. That's very true.
Um, so, um, so how would you help someone shape the idea of a self-care regimen, wellness plan? What would that look like if they came into your office and they said, "Hey, Dr. Scudder, what do I do? How do I make this thing happen? What's the process?"
hmm Initially, so I like to do therapy in a very structured way with my clients. Initially, I'll bring out some theory, some psychology theory. So usually I start with Maslow's hierarchy of needs, and I'll show them the diagram. Oh, there you go. Perfect. You have it framed. Wow, it's amazing. Yes. So I show them the diagram, and then I have them look at it, and I ask them to reflect upon their own lives and where they are and how they're functioning. And that's where I'll start. So initially, I'll ask about sleep, diet, health type of stuff, because that's really the foundation. And then I'll go to the more complex ones that are higher up. So the social needs, family, and then, of course, the top with self actualization, which is your highest potential. Mhm.
Yeah, and I feel like in order for a person to become self-actualized, and for our listeners understanding that this is a place of full fulfillment as a human being, I would say, right? I
Mhm.
think self-care has to be an ingredient to reach that place of self-actualization. Would you agree?
Definitely. I definitely agree. Because I think that's the way that you get there, by balancing all those other parts. hmm
What do your clients normally say when you're, processing this with them? Do they say, wow, I never really thought of it that way? Or it's like, it was, so simple to kind of just implement that stuff. Actually, when you guys get into it, do they say it's easier than they thought it was going to be? They were kind of scared of the unknown. And then once they start practicing it, they feel more
hmm
comfortable with it.
That's essentially what they say, that they feel very comfortable with it after a while. Starting is the hardest for them, just like any new habit. That's how I think of it. because the first time you start doing something is when it's hardest, and then it starts to get internalized after that.
Yeah, getting into that routine, that really is the hardest, because I have some clients too that, I'll have a follow-up session and, we'll kind of talk about that, and they didn't really implement as much stuff. And so it's really just revving up and getting that going to kind of, then it's so much more comfortable, you know.
Absolutely. A lot of it is just getting them to try it too. Like I try to frame it in that way where I'm not pressuring them. So I'm like, here are a few tools. Why don't you pick one that interests you most? And then try that out and let me know how it goes if they're really stuck. Mhm.
Perfect. Yeah, it's interesting. We're kind of encouraging them to enjoy more of their time in their life. And it's almost like we all kind of get scared of that. I know me and Dr. Stokes, when we talk about, what our week looks like, it's like,
Mhm.
oh, we have so many things going on and we feel like we have to kind of do, more. And that perfectionism of, let's go,
Mhm.
go, go, or else nothing's going to happen and be productive. So it's really taking our own advice as well of kind of being mindful of, okay,
Mhm.
let me have a check-in with myself. Where am I at this week? Am I feeling more drained? Can I implement more self-care? And it's just kind of staying on top of yourself to like really feel how you're feeling, you know.
Absolutely. Something that really came to my interest lately was that people are putting a lot of pressure on themselves, even with their hobbies and interests. So they might feel, oh, I'm not engaging in art as much as I should be, or I'm not engaging in playing an instrument. And so they start to feel bad about that. So that's even sadder to me because that's supposed to be what's bringing you pleasure in your free time.
And it really shows the way that people think about these things, right? It's just that, that I think many of us we have sort of a distorted thought process on all of this. And that's one of the things I really try to work on with my clients is just helping them understand their perception
Mhm.
of things like self-care and burnout and reframing their internal experience.
Absolutely. Yeah. So that brings me to like CBT and DBT, which I do a lot of, really challenging negative thought patterns and, yep, thinking errors. Because there are a lot of thoughts we hold and beliefs we have about ourselves that are really self defeating, you know?
Yes,
And
that's
go way back. They could go all the way
Uh-huh.
back to childhood.
Right.
mhm.
Yep. They usually do.
Hmm.
So
Hmm.
with you using those methods, do you give a lot of homework assignments, or how are you with that, of encouraging
Hmm.
them with what they do during their week?
Hmm. For homework assignments, I tend to encourage people to do journaling. So, gratitude journaling, and meditation, visualization exercises. Those are the ones that we tend to do. I even within session will do some grounding techniques. So, the 5, 4, 3, 2, 1 technique, where you're looking at the different things that you see, hear, feel, touch. Mhm. And people really do like that as well. And I think that having them try it within the session kind of forces them to try it. And then also, teaches them how to do it in vivo.
Yeah, that's a great way to kind of integrate that so they know leaving session, okay, I feel confident. I've done this. I can do this now on my own.
Hmm. Absolutely, absolutely. And they'll come back and tell me the next week that they were on the edge of having a panic attack and they tried it and they were able to feel better and bring themselves down. Hmm. And so, of course, that's going to make them do it more.
Mm-hmm.
That positive reinforcement. And I feel like, a lot of people who are struggling with a lack of self-care, it's almost like PTSD in some ways. I mean, the amount of stress that they're experiencing,
Mm-hmm.
um, is pretty severe and significant. And, I mean, I think it shows up a lot of ways. People will dissociate in session and,
Right.
do all kinds of other things. It's because they're so chronically stressed that they're not able to function.
Mm-hmm.
Absolutely. I was reading a book about the immune system this past weekend, like a textbook, and it was talking about, there's a whole chapter about stress and the immune system and how stress is really the worst thing for you, for your physical health. And it's correlated to so many things, heart attacks and cancer and just chronic illness. So it's something you really want to manage.
That's number one, right? Like it's the number one contributing factor to medical issues. Something like I read this, something like 95% of cancers are non-genetic, non-DNA. So meaning more times than not, there's some sort of factor. Now they don't know why, but there's some theory that really points to possibly stress being a major contributing factor.
Wow, that's
Yeah.
scary.
Yeah.
And like you said, Dr. Jeremiah, more than not right now, people are under a lot more stress just with maybe the social climate and everything going on. And everything's kind of more heightened for everyone, I think. So people are experiencing more of that stressor.
I agree, more than ever than I can remember.
In our lifetime, it's definitely a big issue right now.
Yeah. And even for my clients, I also encourage them to use download apps on their phone, because everyone's, you always have your
Absolutely.
phone on you. So apps, help prompt you when you're doing things. So it kind of motivates them to stay mindful of doing those things. So it helps in that way to kind of keep them active and being accountable for their actions.
Absolutely. I love that. And they love that as well because it's like a visual reminder on their phone and they can access it very quickly.
Yeah, they don't have to think too much about it, because if there's prompts or anything that kind of alerts that, how are you doing, or write something down, it kind of gets them, motivated to do that.
I was going to say something that's really helped me personally and thinking large scale about the world and how it feels like you have no control over a lot of things. Actually, using that to your advantage. So thinking about what do you actually have control over versus what do you not have control over as an individual, because that could help you kind of back up and see the perspective of things.
Yeah, that's a really good, I also kind of in the same sentiment ask my clients, what are the facts? Well, I am safe, I'm in control, kind of do all those more facts than feelings of, rather than worrying of what could happen, of what is happening.
Right.
And change your attitude.
Right.
Perfect. Do you have any other tips or anything that you want to share with our listeners?
Sure. Yes. So I don't know if you guys are familiar with the book, The Body Keeps the Score, about trauma. Okay. Yeah, I just read it recently. So I would say within this year. And what really struck me is how the author was talking about how movement, so rhythm, movement, really engaging in the arts and action are what can help you combat trauma, the effects of trauma. So that really, really interested me because I think people have this common misconception as well that, when people go to maybe music events or go out dancing or join martial arts or do yoga and drumming, that they're just doing frivolous things. But in actuality, people are, healing themselves and doing therapeutically, effective methods. So I think being open to those possibilities and alternative methods is really good.
I love that. I love music can change my attitude in a second if I have the right song, I love listening to music. And so I think that's a great tip to kind of give them. And they should read that book to kind of maybe get more in tune with that.
Yeah, it's an excellent book. And, it really points to the fact that I think we embody these emotions, right? This is it's a physiological thing that we're going through here with stress, right? This is not just some sort of abstract concept in our mind. I mean, we are feeling this on a physiological level. And so being able to engage in some sort of physiological coping mechanisms to help alleviate that is intuitively makes sense. So that's a great point.
Exactly. Thank you. Yes. And I think also something I've been doing a lot of is detoxing my influences. So I don't know why, but it wasn't until recently that I realized that we are so influenced by everything we consume. So if we're watching TV, if we're watching a movie, if we're reading a book, if we're watching the news, that's something I really realized. When I was watching the news, I literally was getting sad within minutes because of all the negativity that was being portrayed. Like, not even like a break in the negativity. So that's something I had to limit for myself. So I don't know if other people have also had that experience within the past few years.
No, that's a great point. On my phone, I make sure I don't get any alerts of like any news just because I feel like I get triggered. Like I don't want to see those negative things. I like to keep it lighthearted and
Mm-hmm.
good things because I know right now I don't want to have that stuff. So that's a really good point that you make.
Mm-hmm. Alternative I've done instead of watching the news is having like the banners come up on the news app, or yeah, because I'm able to have more selection, I would say, of what I read. Hmm.
Yeah, taking control of what you see in your day can help. That's a really
Right.
good point. Well, we want to thank you so much for joining us today, and we'll put your links up so people, can find you. Um,
Mhm.
and we want to thank our listeners for taking the time out today to spend some time with us, and we'll see you guys next time.
Thank you for the opportunity. Take care, guys.
Thank you so much for joining us here today on the Counseling Podcast with Dr. Jaclyn and Dr. Stokes. Please take this time to thank yourself for putting in the work. If this episode impacted you in any way, let us know with a loving and honest review. If you have any questions or want to continue the conversation from today, you can reach out to us at thecounselingpodcast@gmail.com, and we can answer your questions right here on the show. Or you can find Dr. Jaclyn and Dr. Stokes on Instagram at DocJaclyn and at Dr.Jeremiah.Stokes.